अब आएगा। Hello students, good morning. Today we will discuss the anatomy spottings. So in today's video, we will discuss the soft parts which we generally have in your exams. So जैसा कि आप थंबनेल देख सकते हैं, यहाँ पे कुछ सॉफ्ट पार्ट्स मैंने डिस्प्ले किए हुए हैं. तो आज हम इन्हीं सॉफ्ट पार्ट्स के बारे में डिस्कस करेंगे. व्हाट क्वेश्चन यू हैव, आई विल ट्राई टू explain in both Hindi and English. So the students, those are from the English medium or from the other part of India also. I will make sure that the language should not be the barrier in this session. So I will speak in both the Hindi as well as English. So let's start with the first spotting. Now generally you have the spottings from the regions lower limb, upper limb, thorax, abdomen, like this. So the first we are having the some spottings from the lower limb. So this is the first spot. Now when you will have the two such sets, now the first question will come that which is the upper part of this specimen and which is the lower part. यानी कि जब आपके पास बच्चों ये स्पेसिमेन आता है तो यहाँ पे आप देखिए कि दिस इज द वन एंड ऑफ दिस सेक्शन एंड दिस इज द अनदर एंड. नाउ in this similar one, what I did is that I reversed this specimen picture image. So now you will have one end is here, one end is here. Clear? So now which is the cranial end, which is the upper end of this limb? Now as I already told you, we are discussing the lower limb spot. So because the lower limb का spot है तो but obviously we are having the femur, tibia, fibula and all this thing, and you can appreciate that this is the posterior part of your lower limb where you are having this diamond shaped popliteal fossa which is visible here and here also. But now the question comes is that the important thing is about the so important thing is about the which is the upper part and which is the lower part. So dear students, now here you have to understand that, see, this is your one muscle. Now this muscle is arising from the inner aspect of the fossa. You can make this. तो यहाँ पे बच्चों ये देखिए कि जो ये मसल है ना, इसके दोनों एंड बहुत पास है और ये जो बाउंड्री है, ये बाउंड्री बनाने के बाद मसल बाहर की तरफ जा रही है. नाउ यू कैन सी दैट द मसल इज गोइंग आउटसाइड. क्लियर? In this specimen, you can see the muscle is approximating here. The muscle is approximately here, and you can see that this is the muscle which is going outside. So here you can see that it is just a reverse view. एकदम उल्टे व्यू हैं दोनों. So which is the upper end? This is the upper end, or this is the upper end. Now I think first, whenever you have such specimen in your exam, this will become the most important thing to understand that which is the upper end. I think you have to check this part which I am explaining again and again. So my dear students, यहाँ पे in this specimen, this is the upper end, this is the lower end. Clear? And it is a reverse where this is the lower end and this is the upper end. Now how? Now let's see this in the next slide. Now on this side you can see the image. Now we are taking this image from this much portion, and now here you can see that ये जो मसल है, ये मसल का ओरिजिन अगर आप देखेंगे तो द बोथ पार्ट आर वेरी नियर टू ईच अदर. नाउ यू कैन सी दिस इज द गैस्ट्रोक्नीमियस and the origin of the gastrocnemius, both heads are from the nearer to each other, and you can see that the upper muscles are going away from each other. तो यहाँ पे ऊपर वाली जो मसल्स हैं ये एक दूसरे से दूर जा रही हैं और नीचे वाली ये जो मसल्स हैं ये एक दूसरे के पास हैं. So because of this reason, now you can understand that यहाँ पे अगर आप देखेंगे तो ये दोनों मसल्स एक दूसरे के पास हैं और यहाँ पे दे आर गोइंग अवे फ्रॉम ईच अदर. सो यू विल फाइंड दैट ये जो पोर्शन है दिस इज द गैस्ट्रोक्नीमियस एरिया and that's why this is your lower area of the specimen, where you can see that this is the gastrocnemius area which are nearer to each other. That's why this is the lower area or lower end of the specimen. So now what you are able to understand that this is the upper boundaries and these are the two lower boundaries. I hope कि जब भी हमारे पास whenever we have the specimens you should be very much sure about this कि हर specimen का upper end and lower end identify करना जरूरी. Now what is this? Now you can see that there is a pin. Now this probe is going into this structure. So now here you can see on the popliteal fossa you are having a nerve which is entering from the upper part. Now this is your sciatic nerve. And near the apex, the sciatic nerve is dividing into the two part. It is a vertical downward line. This is your tibial nerve and it is going laterally. Now this, why I am saying this, how to identify. Suppose I am having this question, what is this muscle? Now if you have the question, identify this structure. So for this, you have to understand that if I am talking about the identification of this particular muscle, you can take this as a landmark. Now we know that there are two nerves. One is common peroneal nerve which will go laterally and the tibial nerve which will go vertically straight. So in this way, because it is going laterally and it is a common peroneal nerve, this will become upper and lateral boundary. This will become upper and medial boundary. So in such case, these two muscles are known as semimembranosus and semitendinosus, and this is become your biceps femoris. And these are the two lower part boundaries which are formed by the gastrocnemius. So बच्चों ये question बहुत बार आता है. You have the popliteal fossa in exam so many times, very frequently. The question always comes, but at the end you have to identify which is the upper end, which is the lower end of the specimen. So what I told you, the most important thing is that you can identify with the help of the origin of gastrocnemius. Now if you will have the very nearer origin of the two muscles head, that means it's a gastrocnemius. And if you are having the separation and if you see the muscles are going apart, these are the upper boundaries. So this is the upper boundary and these are the two lower boundaries. So dear students, my sincere suggestion is that whenever you are having the spots in your exam, first you have to identify the cranial end and the caudal end, or you should say upper and lower end, and then you will go with the structures. So what could be the another possibilities of the question, that in this, suppose in this specimen you will have what are these muscles, what is the nerve supply of these muscles, what is this muscle, what is this structure. So right now we are having the two nerves here. This is the tibial nerve, this is the common peroneal nerve. Clear? So such questions are there in your exam. So this is a spot. This is one of the example that identify the pinned or the marked structure. So my dear students, now it is clear that we are dealing with this common peroneal nerve and name the muscle supplied by it. So which nerves, which muscle supplied by the common peroneal? We know that it is a nerve of the anterior compartment and the lateral compartment of the leg. So you can write down the muscles of anterior and lateral compartment which are supplied by the common peroneal. And lastly, you will have the clinical condition due to injury. Now see, common peroneal nerve most commonly injured at this point. Now you know that what is this point? Now this point is near the neck of fibula, and if there is a compression occurs at this point, it is known as your foot drop. So write the clinical condition occurs due to injury of this structure. Answer is foot drop. Clear? So the first question is identify the marked structure. So what is the marked structure is? Answer is your common peroneal nerve or common fibular nerve. Name the muscles supplied by it. So you have to write down the muscles of anterior and lateral compartment of leg and write the clinical condition. Answer is foot drop. Clear? So these are the one of the example of this short spot. Clear? You may have the same question regarding the tibial nerve. You may have the flag on this structure, identify the muscle, write down its nerve supply. So it is a gastrocnemius and it is supplied by the tibial nerve. Clear? So now let's move to the next part. Now what is about the other questions? First is the hamstring. Now hamstring muscle, what is hamstring? I told you about the tibial nerve. Hamstring is a group of muscle which are present in the posterior compartment of thigh. They are present in the posterior compartment of thigh, and we have already defined the upper end and the lower end of this specimen. So this is your upper end. So you may have the flag on these muscles and you have the question that identify these muscles and what is the single name used for these muscles. So my dear student, these are the hamstring muscles and you know that hamstrings are the posterior compartment muscle. And hamstring का nerve supply क्या होता है? What is the characteristic? So hamstring के characteristics आपने पढ़े होंगे कि hamstrings are the group of 4 muscles, semitendinosus, semimembranosus. You will have the biceps femoris long head and you will have the adductor magnus. Clear? So, and these all 4 muscles are having the features like they arises from the hip bone, they are going to the one of the leg bone, they are supplied by one of the component of sciatic nerve. So these such questions may ask from this spot. So here this is the diagram where again you can appreciate that this diamond shaped fossa which is known as popliteal fossa, but my concern is not to actually understand this diamond. You have to understand the boundaries. So here you can see that this is the lower boundaries. एंड मैंने अभी आपको बताया बच्चों कि जो गैस्ट्रोक्नीमियस के हेड होते हैं वो एक दूसरे के बहुत ज्यादा नजदीक से अराइज होते हैं और जो ऊपर वाली बाउंड्री होती है वो डेविएट हो जाती है. तो आप यहाँ देखो ये डेविएट हो रही हैं दोनों बाउंड्रीज और नीचे वाली बाउंड्रीज या लोअर बाउंड्रीज एक दूसरे के बहुत पास हैं. तो इसलिए हमेशा ये वाला पार्ट क्या हो जाएगा इस डायमंड का लोअर पार्ट और ये क्या हो जाएगा इस डायमंड का अपर पार्ट. क्लियर? सो नाउ here you can see that this is your spot and this is the line diagram from your book where you can see this is a common peroneal nerve and this nerve is going laterally and we are having the question about this nerve itself here. So now you can see that it is supplied the short head of biceps, it will give the genicular nerve. So you have such questions in your exam. And the another most important thing is that अगर मैं आपको कहूं कि स्टीबियल नर्व को मैं कट कर दूं तो इसके नीचे मुझे क्या मिलेगा. तो यहां पे आपको देखना है बच्चों कि बिकॉज वी आर गोइंग ऑन द पोस्टीरियर एस्पेक्ट और पीछे से हम आगे की तरफ जाएंगे. तो इन दिस डायग्राम यू कैन सी दैट द मोस्ट सुपरफिशियल पोस्टीरियर स्ट्रक्चर इज द नर्व, देन यू विल हैव दिस पॉप्लिटियल वेन एंड डीपेस्ट वन इज द आर्टरी. तो यू कैन सी दैट यहाँ पे आर्टरी बिल्कुल सबसे अंदर है एंड इट इज वेरी क्लोज टू द बोन. So in this next this here also, now this is a small video clip where you can appreciate that we have put a mark here. Now what is this point? This is your common peroneal nerve. Now here you can see that this specimen is again of your posterior part of the lower end of femur and upper tibia, and in this specimen also you will find that this is your sciatic nerve which is dividing into the 2 part. So such questions are very common in your exam. Now this is what you have to understand. Now in this image, this is again your posterior view of the popliteal fossa, but here the probe is inside the fossa and you have to identify this structure. And I just told you that there are 3 structures. From superficial to outside deep, you will have the tibial nerve, then you will have the popliteal vein, and deepest is popliteal artery. सो हेयर वी आर डीलिंग विद द पॉप्लिटेल आर्टरी. इसके अंदर यहाँ आपको बहुत ध्यान से देखना है कि हमने नर्व नहीं लगाई है. बच्चों देखो नर्व अगर आप यहाँ देखेंगे इन दिस इमेज, दिस इज द नर्व विच वी हैव कट एंड प्लेस्ड ऑन द साइड. यहाँ पे हमने नर्व को काट के साइड में डाल दिया है. सो इट कैन नॉट बी द टिबियल नर्व. वेन आप देख पा रहे हैं, ये मोटा सा जो स्ट्रक्चर है, दिस थिकर ट्यूब इज द वेन एंड नाउ दिस इज द नर्व. This is the artery. So here, this is the question, this one. You can see the probe is in the popliteal artery. Clear? So it is not the nerve. Why? Because nerve is the most superficial structure, and you can see ये जो है ये structure जिसको हमने काट के साइड में डाल दिया है. We cut and just put it on the side. Now this is your vein, and we are dealing. This structure is the artery. So this is again the important concept to understand, that sometimes you have the question on the artery, and then you have to be cautious enough to identify and differentiate the nerve, vein, and all. So you can see this video clip again. Now in this clip, if you will go deep into the fossa, now this will make more clear to you that this is the artery, and here you will have the probe, and this is the vein. So you have the differentiation between the artery and vein. And vein is superficial and artery is the deepest structure. Clear? And the nerve is the most superficial, which you already cut and we kept it on the side. So sometimes the student make very common mistake here to identify. Clear? So here in this image again, you can identify the three structures. So this red one is the deeper one, and the question was on this popliteal artery itself. So here, this is one more video clip. Now in this, I just separate the two ends. Now what these boundaries I am separating? I am separating the upper boundaries. Clear? So this will be your upper end. This is your lower end, because again you have to understand that gastrocnemius heads are very near. Now first we have separate this nerve. Then you can see this is the vein, and now this is the artery. Clear? So there should be no confusion about the identification. So first what you have to identify which is the upper end, which is the lower end, and then you have to be very much confirm about the tibial nerve, then popliteal vein, and then the artery. Clear? So this is the tibial nerve, this is the popliteal vein, and this is the popliteal artery, and you have seen that artery is the deeper one. Now this is the overall dissection of your lower limb. Now in this, what you are able to see, this is the head of the femur, and this head of the femur is very well visible here. Now this is the anterior aspect, because you can see the sartorius muscle. Now you know that sartorius muscle is having an oblique course, and these are the component of your quadriceps femoris muscle. So if you will see this video clip here also, you can appreciate that if you will go downward from this head, now here you will reach to the knee joint. This is the knee joint. Then you will go downward. This is the tibia, and then this is your ankle joint, and lastly is the foot. So in this whole length of your lower limb, you have the questions based on the different part of your front of thigh. In the front of thigh, most commonly you have the question based on this sartorius muscle. So you have the flag on the sartorius, and the question will come that identify this structure and write down its nerve supply. So sartorius, you know that it is a muscle of the front of thigh. It is supplied by femoral nerve. Then you have the question related to the lateral compartment muscle. You have the flag here. So this lateral compartment muscles are peroneus longus and brevis, and they are supplied by the branch of the fibular nerve. They are supplied by the branch of fibular nerve. Clear? Now this is the posterior compartment. Now in this posterior compartment, what you are able to understand, that this posterior compartment of the thigh is having this big muscle. Now this is the big muscle, and this big muscle is gluteus maximus. So it is a most common question. You have the flag here, and the question comes is identify this muscle. So this muscle is known as gluteus maximus. And what is the nerve supply of gluteus maximus? You know that it is inferior gluteal nerve. And you have the question that what is the action of gluteus maximus? So dear students, gluteus maximus is a extensor at hip joint. Now there is a one more important structure. Now this is the structure. Now you can see that this structure is receiving the insertion of the fibers of gluteus maximus. And what is this? This is known as iliotibial tract. So you have the question on this thick fibrous structure which is iliotibial tract. Now ये जो आपका पॉइंट है, यहां से अगर आप नीचे जा रहे हैं बच्चों, तो ये आपको ध्यान रखना है कि देयर इज ए अगेन बाइफर्केशन ऑफ द मसल. द मसल्स आर गोइंग इन द टू डिफरेंट डायरेक्शन एंड यू हैव टू कीप दिस थिंग इन माइंड कि यहाँ पे एक कॉमन ओरिजिन है, दैट इज फ्रॉम द ischial tuberosity. एंड ये मसल जब नीचे जा रही हैं तो दे आर डाइवर्टिंग बिकॉज दे आर hamstring, which you know that hamstrings are the muscles which are actually present in the back of thigh. So because of this reason you can see that we are dealing with the posterior compartment. So here you can appreciate this is the back of thigh muscle. Now this is your, again you have to identify, this is the one side of the boundary, this is the another side of the boundary. These are the two gastrocnemius and this is the depth where you can visualize your structures of the popliteal fossa. Clear? This is again the gastrocnemius. Deep to that you will have the soleus here. This is your tendoachilles. This is the tendoachilles and this tendoachilles attached on this bone is known as calcaneum. Clear? So you may have the question in exam, identify this thick tendon. So my dear students, it is known as Achilles tendon and this tendocalcaneum or Achilles tendon is formed by the three muscle, gastrocnemius, soleus and plantaris. And this is your bone. This bone is known as calcaneum. And what is the action of this muscle group? So you know that they all are responsible for the plantar flexion. Now you have such questions with the some other spot, identify the structures, their muscle supplied by it, clinical condition like this. Now this is the cut part of your leg. Now in this part, if you will see this video clip, what you are able to appreciate that we are dealing with the lowermost segment of your lower limb. Now here the most important question comes on this part. Now what is this? This is your gastrocnemius. And this gastrocnemius, you know that it is a calf muscle which is supplied by your tibial now. Clear? Now this is the another part of the foot. Now here in this foot, you are able to see the lateral aspect. Why lateral aspect? This is your little toe. This is your great toe. So here we are dealing with this lateral border of the foot, and on the lateral border of the foot, this is your two tendons, and these are the questions. Now what is this, my dear students? This is your lateral malleolus. बच्चों ये lateral malleolus के पीछे आपको दो टेंडन नजर आ रहे हैं, एक ये है, एक ये है. So इन टेंडन्स पे बहुत बार क्वेश्चन आता है. ये टेंडन्स क्या है बच्चों? बिकॉज ये लैटरल बॉर्डर है तो ये लैटरल कंपार्टमेंट है, ये लैटरल कंपार्टमेंट है तो ये क्या है? दीज आर द पेरोनियस लॉन्गस एंड ब्रेविस. नाउ विच वन इज लॉन्गस, विच वन इज ब्रेविस, दैट विल डिस्कस. नाउ हियर यू कैन सी वन मोर स्ट्रक्चर. नाउ व्हाट इज दिस? दिस इज नोन एज रेटिनाकुलम. क्लियर? नाउ व्हाट इज दिस टेंडन? दीज टेंडन्स आर एक्सटेंसर digitorum and these tendons which are extensor digitorum longus tendons are going into the respective toes. Clear? So this is the important thing in this image. Now here the question is identify the pinned or the marked structure. So let's see this video clip first and then we'll decide that which tendon is there which has been marked in this spot. Now if you see and very carefully, now what you are able to understand that first we are dealing with the lateral border. Why lateral border? Because ये क्या है बच्चों? This is a little toe and this will become then the lateral malleolus. Now behind the lateral malleolus we are able to see the two tendons. एक टेंडन ये है, एक टेंडन ये है. अब हमें पता है कि यहाँ पे दो टेंडन है हमारे पास, पेरोनियस लॉन्गस और इट इज ऑल्सो नोन एज फिबुलर लॉन्गस एंड पेरोनियस ब्रेविस और फिबुलर ब्रेविस. नाउ अब अगर आप यहां देखेंगे, नाउ सी व्हाट आई डिड इज आई जस्ट जूम दिस एरिया, जो पिन लगा हुआ है उसको मैंने एनलार्ज किया है, एंड साइमल्टेनियसली वी आर वॉचिंग द इमेज हेयर। अगर हम इस इमेज को इस स्पॉट से कंपेयर करें तो आपको क्या पता चलेगा बच्चों कि ये लैटरल मैल्यूलस है। इस लैटरल मैल्यूलस के पीछे दो टेंडन होते हैं, विच यू कैन सी हेयर। दिस इज योर पेरोनियस लॉन्गस विच इज ए सुपरफिशियल मसल, and this is the peroneus brevis which is a deep muscle. Clear? Now this is the longus, and when you will see the longus, this longus is going deep, while this brevis will end at this fifth metatarsal. So here what you are able to see that this is going to end here at this point, while the longus is going deep. तो बच्चों ये जो मसल है जिसके टेंडन पे यहाँ पिन लगा हुआ है, ये कौन सा हो गया? दिस इज योर ब्रेविस. व्हाट इज दैट? दिस इज योर ब्रेविस एंड दिस विल बिकम लॉन्गस. क्लियर? सो हम जब भी यहाँ देखेंगे तो आपको क्या पता चलेगा कि लॉन्गस टेंडन इज सुपरफिशियल, ब्रेविस इज डीप, बट एज यू विल गो डाउन द ब्रेविस इज बिकम सुपीरियर and the longus become inferior. Clear? And longus, we know that it make a groove in this bone. Now what is this bone? This is your cuboid. So इस cuboid के नीचे आपको एक groove मिलता है, उस groove में ये longus का tendon चला जाता है, and brevis का tendon कहाँ insert हो गया? This fifth metatarsal के base पे. Clear? So this is what is the important thing in this part. So here also you can appreciate, now this is the lateral border. So here I am talking about this retinaculum. So बच्चों ये जो retinaculum है, this is known as inferior extensor retinaculum, and ये inferior extensor retinaculum यहाँ पे है. This is the inferior extensor retinaculum. So you can see that this retinaculum is here, and you have the question identify. So what should be your answer on this band? Answer is inferior extensor retinaculum. So these are the some important discussions on the your lower limb spotters. Now we'll move to the upper limb spotting. Now when you see the upper limb spotting, again you will have such question: identify the pinned marked area and write its origin, insertion and nerve supply. So dear students, before going ahead, we'll see some comments. Okay, someone asked me about the active and passive foot drop. देखिए एक्टिव पैसिव फुट ड्रॉप क्या होता है. नाउ सी देयर आर टू थिंग अबाउट द फुट ड्रॉप कि व्हेनेवर the anterior compartment muscles will paralyze. Now this is your anterior compartment. When the muscles will get paralyzed, what will happen? That your foot will go downward. That means it will go in the plantar flexion. So it is a normal definition of the foot drop. So foot drop is defined as when there is a common peroneal nerve injury, and in that condition what will happen, that the foot will go into the plantar flexion, which is known as foot drop. Clear? But dear students, this is actually happening on the contrary, because the muscles which are acting posteriorly, that means your flexors muscle. So flexor muscles का जो tone होता है, that is maintained here. And this part is not working because the muscles of anterior compartment paralyzed. So what will happen that the tone of this muscles are also responsible to make this foot drop. But suppose there is a condition where you are having the involvement of both nerves, posterior compartment nerve as well as anterior compartment nerve. So now what will the position of your foot? Again, your foot will go in the plantar flexion. Now this time this foot is going in the plantar flexion not because of the tone of these muscles, because they are also paralyzed. But then why the foot is in this condition? Because under the effect of gravity. So when the anterior and posterior both compartment nerves paralyzed, it is known as passive foot drop, because there is no action of any muscle and we are there because of the gravity. But if only the anterior compartment muscles paralyzed, then the foot is dropped because there is some tone in the posterior compartment muscles which will make the foot in the foot drop position, that is in the plantar flexion. So this is the difference. So now we'll move to the upper limb spotting. So in the upper limb spotting here, dear students, you can see the probe in this part. Now what is this? Now this is the long head of biceps femoris. And this long head of biceps femoris is going down, and here you can see that this is the another head of the biceps femoris, and they will join to form the biceps brachii. So identify the structure. Answer is the long head of biceps femoris. Write down the origin. So the long head comes from the your supraglenoid tubercle of the scapula. Where is the insertion? They will insert in the radius on the radial tuberosity, and you know now supplies by the axillary nerve. But the question comes is about how to differentiate the anterior and posterior aspect. बच्चों देखिए, जब भी आप एंटीरियर एंड पोस्टीरियर एस्पेक्ट की बात करेंगे तो एंटीरियर एस्पेक्ट और पोस्टीरियर एस्पेक्ट में डिफरेंस करना बहुत जरूरी है, बिकॉज सबसे ज़्यादा कंफ्यूजन बच्चों को ये होता है कि सर ये हमारा एंटीरियर एस्पेक्ट है या ये एंटीरियर एस्पेक्ट है. सो इसको डिफरेंशिएट कैसे करेंगे? सो यू हैव टू अंडरस्टैंड दैट व्हेन वी विल गो पोस्टीरियर साइड, you don't have such artery. Now you can see this artery is visible. Now this is your axillary artery and this is your axillary vein. So these tubular structures not at all present here. Second thing is that you have the biceps. Here it is not present. And the third thing is, on the posterior aspect you can feel this bony prominence. Now this is the spinous process of the scapula, which is very prominent feature. So अगर आपको confusion है तो you can palpate the scapula, and if you are able to feel this bony prominence, which is a spinous process, that means you are dealing with the dorsal aspect or the posterior aspect of your upper limb. Clear? So now what are the questions you may have? Identify this muscle. It is infraspinatus. This is your supraspinatus. Now here you are having the two muscle. Now this is the posterior compartment, as I already told you. So what this muscle is, this is your triceps. It is triceps. And you know that this is the long head of triceps. Now the one muscle is going posterior to the triceps, and this is the muscle which is going anterior to the triceps. So you have to differentiate first between these two muscles, which is a very commonly asked question. So dear student, this muscle is going anterior to the long head. So this is your teres major, and this muscle is going behind the long head to the humerus. So it is teres minor. Clear? So this is the important thing. Whenever you are having the two spots upper limb, you have to first differentiate the anterior and posterior aspect. Now in this video, if you will see, you have the question regarding the spaces. So this is the dorsal surface which we are dealing, and here you can see that this is the triceps. This is the lateral head of triceps. Now why this is the lateral head? Because the lateral head arises from the posterior surface of the humerus. So here you can very clearly see that it is having the attachment on humerus. This is the long head of the triceps. If you will rotate this specimen, you will find that you don't have the biceps attachment on the humerus, Plus here you can see this is the subscapularis muscle, and the important thing is you can see the cut margin of the serratus anterior where I can put my finger inside, and this subscapularis and serratus anterior should be identified separately. Then you will have this axillary artery, and you know that axillary artery is divided into the three part. On the dorsal side you will find you don't have the such artery, and you have the spaces which you can see in here. These are known as subscapular space. This is the upper triangular space, this is the lower triangular space, and this is your quadrangular space. So many times you have the question regarding these spaces and the boundaries. So you should be able to identify the spaces on the posterior side, and this is your supra and infraspinatus muscles, and this is your spinous process of scapula. Clear? So in such a way you should be able to identify your bony landmarks and the muscles whenever you are dealing with the spotting specimens. Now I'll move to the pelvis. Now in the pelvis, the most common question comes on this. Now you have the sections of the male and female pelvis. So here we are dealing with the female pelvis. Now how, that we'll discuss in the coming slide. So right now the pelvis which is you are able to see on your screens is actually the female pelvis. So here what important things we are able to see. Now this is your sacrum. Now this is your sacrum posteriorly, and in front of the sacrum you can see this is a lumen of your lower part of GIT, that is your rectum, and this is the continuation of the rectum with the terminal end of anal canal. So this is your anus. Now anterior to the anus you can see this is the vaginal canal. Here you can see this is the canal, and this vaginal canal is continue here. This is the cervix, and above the cervix you can see this is your uterus. Here you are uterine cavity is there, and anterior to the uterine cavity you can see this is a bladder, and this is the female urethra which is visible here. So in such a way, when you will have the structures inside the female pelvis, anteriorly you will have the bladder, posteriorly you will have the rectum, and in the middle part you will have this uterus. Now this is your pubic symphysis. Clear? Now in this female pelvis, what you are able to understand that from the uterus on the side you can see this is a fallopian tube, and below the fallopian tube this part is your broad ligament. So you may have the flag on this area, this is a broad ligament. You may have the flag on this, it is a uterus. This is cervix, it is a vaginal canal, this is the anal canal, and this is the female urethra. Clear? So when you will see the pouches in this cavity, sometimes you have the question, so what is this pouch? This is uterus and this is the bladder, so it is known as vesico-uterine pouch. So this is a vesico-uterine pouch. On the posterior side you will have one more pouch. Now this pouch is between the rectum and the uterus, so it is known as recto-uterine pouch. So there are two pouches are seen in the female pelvis. On the side here you can see this is the ovary, and this is a connection. This is the fallopian tube in the upper part which is known as transverse ligament. Below that this is a big area, and this is the dual fold of the peritoneum which is forming the broad ligament. So now here whenever you are having the male female pelvis, you can identify with the external genitalia also. The penile portion is always visible in the males, which is never visible in the females. Plus in the female pelvis you will find this additional organ which is the uterus. Clear? Now here again, for the better understanding, I put the diagram for the comparison. So now you can see that this is your uterine cavity and the uterus, which very well visible here. This is the uterine part. Clear? Now this is your cervical area, and it is here. Now this is your vaginal canal which is here. Anterior to that this is urinary bladder. This is the anal canal and the rectum. So you can appreciate this is the anal canal and this is the rectum. Clear? On the side here you can see this is the ovary and this is your fallopian tube in this diagram, which you can appreciate in the image also. This is the ovary and this is the fallopian tube. So बच्चों ये क्या हुआ? What is this? This is your broad ligament. Clear? So it is easy to understand, but in this specimen in exam you have other than this. यहाँ पे और भी बहुत सारी चीजें हैं जो आपके एग्जाम में आती हैं. What you can have the marking on this area. What is this area? This is actually your vertebral column. Now inside this canal, vertebral canal, you can see that this is your dura mater, which is spinal dura, and you can have these ends of cauda equina. So sometimes you may have the flag in this region, sometimes you have the flag in this area. Identify this. What is this? This is an intervertebral disc which is present between the lumbar and the sacrum. Clear? And identify this. This is your sacrum. So what are the structures you may have in exam? You may have the flag on the pubic symphysis, type of the joint formed by this. You may have the flag on this cavity, that is urinary bladder. You may have the flag on this area, it is a broad ligament. You may have the flag on this, it is a fallopian tube. This is your ovary, this is your uterus. Here you will have the cervix. This is your anal canal. Now this anterior part is your one pouch, that is your vesico-uterine pouch, and the posteriorly you will have the recto-uterine pouch. Now in this video clip you can very well appreciate the things. Now here you have to first always identify the posterior part. So posterior part is this, where you will have this vertebral column and the sacrum. Then you can see this is your uterus, this is ovaries, and anteriorly this is the bladder. Now most of the time students are having the confusion between the rectum and the bladder. So my dear student, there should be no confusion. You have to identify the sacrum and the pubic symphysis. Anything which is behind the pubic symphysis has to be the urinary bladder. Anything which is anterior to the sacrum has to be your rectum, and this is your lower end of anal canal. And in the middle portion you will have this vaginal canal, you will have the uterine cavity. Clear? So this is what we discussed. Now we'll move to the one more part, is the head and neck spotters. Now this is again a most commonly asked question in your exam, head and neck spottings. So in the head and neck you have the median section. So what is the difference in both the sections right now which you will have? तो इसमें जो सबसे important difference है कि यहाँ पे जो बच्चे confuse होते हैं, that I am talking about, यहाँ पे आपको nasal septum नजर आ रहा है. This is a septum. But यहाँ पे you don't have the septum, you are able to see the lateral wall of the nose. This is lateral wall of the nose, it is not showing the septum, but here you are having the septum. Why I am saying this? Because ये जो projections हैं जो ये नजर आ रहे हैं बच्चों, ये projections हैं lateral wall of nose के. जबकि यहाँ पे on this you don't have such projections. You are having the smoothness. So this smoothness is there because it is a exactly median section which is showing the septum. And here the septum is not visible, rather than you are having the projections which are known as concas. Clear? So this is the first difference. The second difference is that कि यहाँ पे जब आप नीचे जा रहे हैं तो एक छोटा सा डिफरेंस आपको दिखेगा. तो इसके पार्ट्स जो आप हमें दिख रहे हैं पहले हम उसकी बात करेंगे. तो बच्चों ये जो है दिस इज द हार्ड पैलेट इस वाले स्पेसिमेन में, और इधर ये है हार्ड पैलेट. So posterior to hard palate you will have the soft palate. So this is the soft palate which is here. Now what is this? This is your nasal cavity. यहाँ पे cavity नजर नहीं आ रही है because it is having the septum. यहाँ पे एक important structure नजर आ रहा है. Now this is a very important question. Now ये जो opening नजर आ रही है, now this opening is the opening of eustachian tube, or you can say it is a opening of your auditory tube. नाउ ये जो ओपनिंग होती है इसके आगे ये वाला जो स्ट्रक्चर है ये होता है इंफीरियर नेजल कॉन्का। तो इंफीरियर नेजल कॉन्का का जो पोस्टीरियर एंड है उसके पीछे इफ यू विल हैव ओपनिंग देन इट हैज टू बी योर medial end of eustachian tube, and you know that eustachian tube or auditory tube connect the nasopharynx to the middle ear cavity. Clear? Now this area is known as inferior meatus, this is known as middle meatus, and this is your superior meatus. This is your inferior concha, this is your middle concha, this is your superior concha. So this is the one thing. Second thing, sometimes you have the flag in this structure. Identify the pinned area. So this is a soft palate, and write down in the name of the muscles. So like tensor veli palatii, levator veli palatii, musculus uvuli. Then you will have a lower portion is here. You can see this is a tongue. This is your oral cavity. On the tongue, this is the posterior most part of the tongue which is not visible. And this part is anterior to the pharynx, which is known as pharyngeal wall of the tongue. यहाँ से जब आप नीचे जाएंगे बच्चों तो यहाँ पे आपको दो चीज़ें नज़र आती हैं, एक आप आगे आ जाते हैं, एक आप वर्टिकली सीधे जाते हैं. इफ़ यू आर गोइंग डाउनवर्ड देन इट इज़ द इसोफेगस, बट इफ़ यू आर गोइंग in this direction then you will enter into the trachea. So tracheal tube is here. Now above the tracheal tube you can see this leaf like structure. This is the epiglottis. What is that? Epiglottis. And below the epiglottis now you will enter into the larynx. Now in the larynx you will find two folds. This is the upper fold which is a false vocal cord, and this is a lower fold which is a true vocal cord. So you again have the question, you have the marking on these areas, identify these areas. So this is a larynx where you are dealing with the true and false vocal cord. So the upper one is false and the lower one is true vocal cord, and this is your epiglottis. Clear? Now here you can see there is a space. Now this space is visible between the tongue and the epiglottis. Now this space, you know, it is known as vallecula. It is a vallecula. So vallecula is present between the tongue and the epiglottis. Clear? Now this is a posterior pharyngeal wall. यहाँ पे आप देख रहे हैं this is the dens. Now dens, you know that it is a part of the second cervical vertebra, and this is a ring of the first cervical vertebra. So this is the anterior part of the C1 and this is the posterior part of the C1. This is the C2. Clear? So these are the things which are very commonly asked in your exam. Now you have the question on this also. What is this? Now this is your pituitary fossa. This is a part of the sella turcica, and this is a pituitary fossa where you will have the pituitary gland. What is this? Sometimes the question, this is a frontal air sinus. It is a frontal air sinus. In this image also you can see this is a frontal air sinus. What is this? This is a foramen magnum. From the foramen you can see that this is a spinal cord which is entering downward into the vertebral canal, and these are the spinous process of the cervical region. Clear? Now you can compare both these diagrams. Now here you can see this is the opening which I just told you. It is the opening of your eustachian tube. Now around this opening you will find this projection. Now this projection is known as tubal elevation. It is known as tubal elevation, which you can see. Clear? Apart from that, this I already told you, this is the posterior most part of the tongue, and on this posterior part you can see this elevation. Now these elevations are known as lingual tonsils. What is that? Lingual tonsils. Clear? So you can compare these both. This picture you can compare. I already explained this dens. I will told you about the C1. I will told you the posterior pharyngeal wall, soft palate. I explained you about the epiglottis. Then we have already discussed the vallecula. Vallecula here in this image, this is the vallecula. Clear? Now this is the important specimen, dear students. This specimen is of your larynx and posterior pharyngeal wall. So you can see this video first and then we'll discuss. So right now the pin is in the tongue. So you have the question on the tongue. Then what you are able to see is that if you will go behind the tongue, you will find this epiglottis. Now, this epiglottis and the tongue is having the gap, and this gap which you right now are able to see, these are the two valleculas, and between them you will have a fold. Now, this fold is known as glossoepiglottic fold. This is a glossoepiglottic fold, and on both the side of the fold you will have vallecula. This is a free margin of the epiglottis. Now, I just open the posterior wall of the larynx, and when you enter inside the larynx, you will find this is the upper fold and this is the lower fold. The lower folds are the true vocal cord, the upper fold are the false vocal cord, and this is the interior of the larynx. So, this is the one question which you have to understand in this specimen, that what is vallecula, what is true cord, what is false cord, what is epiglottis. Clear? You will have the one more question of this same specimen. This is the anterior aspect, where you can see this is thyroid cartilage and this is a H-shaped thyroid gland. Clear? Below that you can see this is a tube, is the trachea. Now, above the thyroid, it is hyoid bone. Now, when you will go on the posterior side of the specimen, you have to again identify the same structure from above downward. This is your tongue, then this is epiglottis, this is larynx. Clear? Now, the important question is that what is this space? Now, this space is not inside the larynx, it is outside the larynx. So, outside the larynx, there are two questions. One is this space, this is known as vallecula. Right now, we are in vallecula. Now, what is this? Now, this is a space which is outside the larynx but inside this thyroid cartilage lamina, and this is known as pyriform fossa. So, these are the pyriform fossa and these are the vallecula. Clear? So, pyriform fossa are not inside. We are not going inside the cavity. This is the posterior free margins of the thyroid cartilage. Inside the thyroid cartilage, but outside this airy epiglottic fold, you are having the spaces. Now, this is your pyriform fossa and this is your vallecula. So, this should be very clear in your mind when we are discussing the difference between the pyriform fossa and your vallecula. Clear? So, here this image is given in your book, where you can see that this is your free margin of the epiglottis, this is your airy epiglottic fold, and anterior to that you will have the vallecula. This is the posterior part of the tongue which is visible. We cut this portion to show interior of the larynx, where you have seen the vocal cords, and outside this, here you will have the pyriform fossa. Clear? So, this is all for the today's session, where I told you about some spotting specimens of your upper limb, lower limb, pelvis and head and neck. I hope these spotting specimens will helpful in your exam, and they will definitely help you to identify the different structures whenever you are having the spottings. So, this is all for the today's live session. Thank you for joining this session. Thank you.